Hey y'all, hey, it is Monday. It is 8:30. It means it's time for Conversations with Teresa. Guess what? We have the amazing, outstanding, phenomenal Dr. Vyvyane Loh back with us
Yay.
again from last week. Hey Vivian, how are you?
I'm looking forward to part two.
I am looking forward to part two. It's so crazy. I last week when we got off, I had like a flood of questions. I was like, I'm gonna ask her this, I'm gonna ask her this. And of course I didn't
Yeah.
write it down, right? But it's gonna come because it's all like it was just such great information. And can I brag on me for just a second?
Yeah, of course.
So, well, this is probably what I should have been doing all the time, but I have not missed a day of using my CPAP machine
Oh my God.
since you told me that. I'm like, I'm keeping
Yes.
all my brain cells, I'm keeping all of that stuff up in here. So,
Well, most importantly, how are you feeling?
so I feel better. So okay. I was away at this really intensive training this weekend, so my sleep is a little off. It was like a 10-hour a day training,
Oh, wow.
and like my brain is just a little fried, but I do, it's better. I can't imagine not having done that and then not having used the CPAP machine and then trying to do that. But I slept, like when I slept. It was I don't even think I moved. I used to move a lot when I like shifted a lot in my sleep, but I think I just pretty much stayed where I was.
Okay, so, especially if you find that there are moments in your sleep where you're not moving as much. So that means I think you're getting more REM sleep. Because
Hey.
in REM, if you have normal REM sleep, you're not gonna be moving. Okay, because you have a normal paralysis during REM sleep. But it's really important to have this REM because it helps with memory and consolidation of everything you've learned. So if you were taking that course or training, right? If
Mhm.
you didn't have the REM sleep, it's going to compromise you taking in everything from the day's training and processing it and remembering it,
Okay.
right? And it's also very important for emotional processing. So if someone's been through a traumatic experience or highly, so upsetting emotions, then
Mhm.
having good REM sleep helps you actually process that. And if you disturb the REM sleep, people don't do that processing and the risk for PTSD is much higher.
I'm sorry, the risk for what?
PTSD.
Really? Wow.
Yeah. So people don't realize the importance of sleep. And the other thing you just did by being consistent with your CPAP is that you decrease your risk for diabetes, right? So people
Okay.
don't realize that if you don't sleep, your risk for diabetes is much higher. Your risk for Alzheimer's is much higher, and all the other neurodegenerative disorders, that's a lot higher with poor sleep, right?
Mhm.
Also, it's harder to maintain, let's say, normal metabolism, normal weight if you don't sleep, okay?
Okay.
Because everything is off, and that's going to impact your metabolism, and
Right.
then your body's kind of working against you because
Okay.
it's not getting the rest that it needs. But when you
Right.
correct it, things get back on track.
So I can increase my metabolism. Are you saying
Yes,
by just sleeping?
yes,
I might shed
yes,
a few
yes.
shed a few
And so,
pounds.
interestingly, sometimes people ask me, right? Oh, should I get up at 5 a.m. and go to the gym because they want to maybe use that time to exercise? I'm like, if that's cutting short on your sleep, if I had to pick, I'd stay with the sleep. You're
Really?
not doing yourself any favors by sleeping like 6 hours, 5 hours, 6 hours, and then getting up early to go to the gym. A lot of people try to do that because they say that's the only way that I can squeeze things in. Now, I'm all for exercising, but when you do that, you're working against yourself. And if I had to
Mm.
pick, I'd say get the extra hour. You're going to have way more health benefits than if you tried to push yourself to go to the gym.
Well, look at that.
right?
And that I'm not pushing myself to go to the gym. I will get that extra hour. I will sleep in.
See, I'm the kind of doctor that's telling you to sleep in. So,
Love it.
should
I
be
love it.
everybody's favorite doc, right? At this
That's what
point.
I'm talking about.
Yeah.
Listen, I am super, super excited and super grateful that you're here and just, you're doing it. You're making things happen. Just as far as, I mean, I've been able to have great conversations with people through the week who tuned in. And I'm hoping that some folks, again, if you're on, you have a question, you can go ahead and I think if you're on YouTube, you can put it in the okay,
Comment.
that's
I think.
showing all my technology wisdom, but you can go ahead and ask the question. I'll put it that way. I think if you're on YouTube, you can do that. But just whatever might be on your brain cells. So I'm going to give you one.
All
You've
right.
already answered a couple of different things. We just right off the bat. Oh, but before we go on, I can't, not to be vain or anything like that, but hey, what do you guys think about my hair? I
I think
did
it's
something different.
fab. I saw that before we came on. I was like, oh man, she's making me look bad. She's awesome.
No, listen, this was me. Like, look, I gotta do something, right?
I love
I
those
gotta do
earrings
something.
too.
So this was me
Oh,
doing something, and I'm just trying it out. It is so vastly different than what I've ever had.
see what happens when you get your sleep, Teresa.
Okay, that's what I'm talking about. I think it's all due to you and all due to
Everything changes.
everything changes. So yeah, so I'm just saying, shout out to my girl Beatrice. Thank you for hooking me up. Appreciate that. So just a couple of things. So this is I feel like we were in and out, maybe talking about it, or maybe I was just feeling it. But one of the things that is on my mind and on the minds of so many people around me, maybe probably because of our age, similar age, and things like this, is this perimenopause, menopause. Everything seems to be connected to it. If I got a headache, backache, uh, hair issues, skin issues, feeling this way, that way, it's like it seems like everything is peri or menopause. Like, like what do you do? How can you move through this in the best way?
Okay, well, there's a couple of things, right? You brought up the perimenopause, and even a few years before the perimenopause, the hormones start to shift. So a lot of times we focus just on the menopausal period or maybe the year before, but up to
Mhm.
5 years before, you already will be experiencing shifts in your hormones, right? And then, as you know, once you get to the menopause, then yeah, things change drastically. And
Mhm.
at least metabolically, I always say, okay, it's called menopause because now we're like the men metabolically, okay? Because your
Oh.
health risks now start to be closer to men's health risks. So traditionally, women
Huh.
have less of a heart disease risk, it's not zero, but our cardiovascular risks are traditionally lower than men's, for example. Okay.
Okay.
But when we get to the menopause, then you actually kind of trend towards like the same risk profile as a man. Okay. And that's
Huh.
because we lose, you know, a large component of the estrogen effect, right? And a lot of the protective effects that men have from testosterone, believe it or not, actually comes from estrogen.
Okay.
Yeah, man. They're all like sitting up going, what you talking about? But it's true. Because a certain amount of your testosterone is converted by an enzyme. It's called an aromatase enzyme. This enzyme converts the testosterone to estrogen. And a lot of the protective effects that men can get from testosterone replacement is actually coming from the estrogen. Because if you block the conversion of the testosterone to estrogen, you don't see those protective effects. And obviously in women, we get a lot of protective effects, not just for the heart, but also for your metabolism and also for your bone mass and things like that, right? So
Mm.
I really am a proponent of seriously considering hormone replacement. And
Okay.
I feel like it's been sort of pushed off for a while, but I think that, you know, really when you look at the protective effects of hormone replacement, it's hard not to seriously consider it. Okay.
Okay.
So I think that that's a time when you should find someone who is skilled and understands hormones. So make sure that they have some training along those lines. Just going to your regular doc, I'm going to say, is probably not going to give you a lot of options. You probably want someone who's definitely trained in handling menopausal hormone replacement.
And so where would I go? Who am I going to look for?
So
Uh,
one of the things you can do is Google NAMS, which is North American Menopause Society, right? And
North
you can look up
American. Okay.
um, practitioners on that list because those are people who have very good training in hormone replacement. So NAMS is a good place to start. But
Okay.
there are also other people who specialize in reproductive endocrinology. A lot of times it's more towards fertility, but there's a certain proportion of people in reproductive endocrinology who also do menopause, right?
Hmm.
So that's the kind of doc you want to look out for because then they can help you make some decisions based on risk, right? And it turns out that really, the studies that were done on estrogen and hormonal replacement that kind of said, oh, it's very dangerous, it's bad for you, and things like that. Those are very, very poor studies. And when you
Okay.
look at more recent and better studies, we find that there's a huge protective effect. And I think the first thing you should do is really find someone who knows what they're talking about
Right.
and
Right.
have that discussion and kind of really seriously consider hormone replacement. So that's number one,
Wow.
right?
That's just
Yeah,
number one.
number one. Number two is that you realize that even though, let's say someone does get hormonal replacement, that still doesn't put you completely in the clear because
Okay.
as men and women age, right, we start to shift in our body composition. So over time, over the age of 35 towards 40 and so forth, from that point onwards, we are actually losing muscle. Okay. Now, it might not be evident to you because if you lose 5 pounds of muscle but gain 5 pounds of fat, when you
Mm-hmm.
step on the scale, you're not going to notice it. Your doctor won't notice it. And
Right.
everybody thinks everything's fine, but it's not,
Okay.
right? So, both for men and women, we want to prioritize, kind of keeping our muscle mass because it's the number one predictor in older adults of mortality, of death,
Right.
right? And I think we might have talked a little bit about it
We
last week.
did.
Yeah. So therefore, you have to, for women, especially, this includes men, but I find that women don't get enough protein. So you need to make sure you're eating enough protein. You
Mm-hmm.
need to be doing some form of resistance training. And again, a lot of my women patients love cardio. And I love cardio too, but that can't be it for your exercise. My recommendation is actually 3 days of resistance training with weights, barbells, that kind of thing, and then 2 days of cardio.
Okay.
Okay. And then 1 day of some kind of mobility type exercise, like be a dance class, could be yoga, that kind of thing. And then 1 day where you're just active. You're out hanging out with the family, going for a walk, riding on your bike, that kind of thing, right?
Okay. I
So
know a really good dance teacher.
I
I'm trying to
know.
remember his name.
And on Saturdays, that's
Saturdays.
one way to get in your mobility and a little bit of cardio and
Yeah.
a real antidepressant for your brain too.
I love it. Oh, his name is Carl.
Is
His
he
name
related?
Carl Aline.
I think that's
Yes.
the last name.
Yeah, Saturday mornings. It's like 9:30, 10:30.
Dance
Yeah.
party.
Yeah, I've heard about that class.
9:30 to 10:30 is the dance party. Soul Train. Soul Train. He
Soul
does
Train
Soul
still
Train.
going on. I
That's
love
right.
it. So that no, that's really good because we don't, typically it's just like, exercise more. And so you start, like you said, cardio all the way. And it's just like, okay, I'm doing this, but not really thinking about the muscle. That image in my head, what you said last week was, you know, that you had never seen a walker until you got to America.
Yeah.
And
Yeah.
just like, the elderly in your country was they were doing it.
Most people were still very active, and
Right.
so I think we have to understand that sometimes we're sold this idea of what aging looks like. That's not necessarily true,
Right.
right?
So
So I think making sure you prioritize resistance training, especially as you get older, very important. It's the one that it's hard for me to get my patients to really latch on to, but that's the kind of exercise they need the most, right? So, and it's good for
interesting.
your bones too. Now,
Right. Right.
getting the sleep, right? And making sure that we clear out the processed foods, okay? Because you
Mhm.
really want to make sure that you prioritize nutrition, but you don't want to be, kind of putting a lot of junk in your body.
Right.
Yeah.
Right.
So as we're aging, it becomes more and more important. Yeah.
And you know what? I love how it's a lot more natural. So like I think about like when I was growing up, it was like morning, noon, and night I drank Kool-Aid. Kool-Aid was it. That was my nutritional source. I'm like, I'm using water to make the Kool-Aid. Like I'm getting my water in, right? Things like that. But I can't even believe I'm saying it, but like I can't do it anymore. I can't.
Right.
My
Right.
body's like, there is no way you are putting that in your body. The sugar, like everything is super sweet to me now. And so there are these things that my body is telling me, like, you need to do that. You need to not lay down so much. You need to, you know what I mean? Like there is some
Yeah.
desire to do these things. And so it's awesome the way that our bodies will tell
Start
us
to tell
something.
you. Absolutely. But there are some non-intuitive things. So for example, I think people think that fruit juice is healthy and it isn't.
Oh my
Okay.
gosh, no.
So,
Tastes
yeah.
good, but
So, a
mm,
glass of fruit juice, let's say OJ, orange juice, is pretty much equivalent in terms of sugar load to a glass of regular Coke.
really.
Yeah. So, one of them is 36 grams and the other is 39 grams of sugar. So, they're about,
Mm,
let's say above 30 in grams of sugar in just one glass.
wow.
Right? And for a woman, you shouldn't exceed 25 grams. So that one glass already blew you out of
That's
your
it,
range.
huh?
Yep. Yeah. So
Wow.
you shouldn't do more than 25 grams per day. So that one glass already blew you out. But the other thing is that the main sugar in fruits and fruit juice is called fructose.
Mhm.
And we've heard of high fructose corn syrup, right?
Mhm.
Well, you know what? So if you're drinking OJ and you're drinking other fruit juices, you're getting a very high dose of fructose too. And the thing about fructose is that it is not going to be good for your blood pressure, right? It can increase your blood pressure, but it's also very damaging to the liver. So people who have a
Mm,
diagnosis of fatty liver, people, who have been told that they have maybe some fibrosis in the liver, number one thing I would say is cut out the fructose. They've
okay.
noted that when they gave fructose to kids, that they had fatty liver, and if you just took away the 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 fruit juices and all the high fructose drinks, that their fatty liver went away. Okay.
Okay.
Yeah, so
So
you
it
can
can be, it's
reverse it.
reversible.
Yes. Yes.
Nice.
And most people don't realize that liver fibrosis is reversible. Cirrhosis is like now you have a lot of fibrosis, meaning you have a lot of scars. And
Yeah.
it's still debatable at this point whether it might or might not have some regeneration in the liver and be reversible. But if anyone's listening and they have liver fibrosis, please know for sure that is reversible, but you have to do the right things. And
Right.
one of the things is to avoid fructose. And people don't realize, sometimes they think they're being healthy, so they are avoiding sugar, but they'll use a different sweetener. So for example, agave nectar or agave sweetener, a lot of people use that because they think it's natural and healthy. Well, it's 85% fructose. It's worse than high fructose corn syrup,
Oh
which is
gosh.
which is generally about 65% fructose.
Oh my gosh.
Yeah.
What in the world?
So you do not want to be using agave nectar or agave sweetener for sweetening anything, putting in your coffee or anything,
Ah, well,
right?
that's really discouraging.
So all these details matter, right?
Yeah.
And when you're young, but also as you're hitting menopause, as we age, it's an accumulation. And then there's one other thing, ladies and gentlemen, I hate to tell you this, but I don't know if we talked about this, Teresa. Alcohol is a class 1 carcinogen. Did we talk about that?
We did not talk about that.
Yeah. So, hate to tell everybody, it's a class 1 carcinogen. What is a class 1 carcinogen? Well, let's look at other class 1 carcinogens. Cigarettes, asbestos. Okay. So now a class 1 carcinogen is defined as something that has no safe lowest dose. So how many cigarettes, Dr. Loh, can I smoke and not have the risk of lung cancer? 0. How much asbestos can I inhale and not get lung cancer? 0, right? How much alcohol can I drink at 0?
Wow.
Yeah, it is a class 1 carcinogen. All right. And
So
a
all
lot of
this
people say,
drinking a glass of wine thing?
yeah, no. And it's not good for your heart either, because the latest studies that use genetic markers have shown that actually alcohol harms the heart, right? And so the more you drink, the more harmful it is to the heart. And it puts you at risk for an irregular heart rhythm called atrial fibrillation. Okay. So if you have high blood pressure, you have atrial fibrillation, you do not want to drink. You do not want to drink because it puts you at risk for having irregular rhythm that'll take you to the ER. Right.
Man.
So yeah, I know people don't, people go, oh, well, but surely one drink and it's good for your heart. No, the latest studies using genetic markers have shown that it doesn't, and in fact harms the heart. And one more thing is that every drink you do, right, you're going to be depositing iron in your brain. Iron in your brain. Does that sound
Come on
like a
now.
good thing to have iron in your brain?
Oh
I
no.
think not, right? Yeah.
I'm thinking
But there's a
not.
lot of studies that have been showing that with alcohol use, right, you get iron deposits in your brain, and that can set you up for a lot of inflammation and damage to the brain. Iron is
Wow.
very interesting. Yeah, it is needed by our bodies, but it also is very it can be under certain circumstances very, very inflammatory, very damaging.
Okay. Well, yeah, I mean that's a bummer. I've got no tolerance for alcohol. I guess that's a good thing.
Yeah,
Um,
it is a very good thing.
but
It is.
still, I mean, there's every once in a while, like you think that you want, okay, let me try this or whatever, whatever. But yeah, I
And the
just heard everyone
cocktails,
talking about that.
yeah, the cocktails and mixes are worse. Why? Because alcohol is mixed with fructose in the cocktail. I just told you how bad the fructose is for your liver.
Right,
And then the
right.
alcohol, I'm like, okay,
No
can we
sangria?
have a
What?
can we have a more toxic drink? No, yeah, here we go. See?
Okay.
I know.
Fine.
Well, I started off like being everybody's favorite because I told them they could sleep in. But now they're not so sure after I told them no alcohol, right? So
No,
they're not
it's all
sure.
good.
Yeah.
It's all good. Okay. All right. Um, let's see. I know we only have a few more minutes, but can you talk about vitamins? And we touched upon that a little bit last week, but I mean, there are a bazillion and eight different vitamins to take. Like, how do you know without just Googling, right? What vitamins, how much, what brand? Like, there's just the options are, all I know is that the whole fruity, gummy, sugary ones
Yeah,
are,
don't do those.
let's not do that. That's what I know. And then again, you talked about like having zinc and obviously having iron and different things like that. But I want a multivitamin. Let's say I want a multivitamin. Where should I look? What should I be looking for? 1,000 milligrams, 10,000 milligrams. I'm like, oh my gosh, like what do you do?
Well, it's really hard, as you said, because there's no standardization. So different brands will use different amounts and so forth, right? Also, they'll use different formulations. Now, for me, it's exactly what happened. I used to tell people to go get, vitamins and fish oil and I didn't care. I just said, oh, just go. Maybe go to Whole Foods. You'll find something there, right? And then discovered that a lot of the vitamins that are sold on the shelves, they don't come with active ingredients. Okay, so I'll give you an example. A lot of people think that beta carotene is vitamin A. It is not vitamin A. It is only a precursor to, that means it can be converted to vitamin A, but it in itself is not vitamin A. Vitamin A is something called retinoic acid. Okay, now
Hmm.
everybody's thinking this beta carotene, which you can find in carrots and things like that, and they're thinking they're getting a lot of vitamin A. Well, the conversion of beta carotene to active vitamin A can be 3%, which is almost nothing, or 30% at best, which is still kind of not much, right? And
Okay.
it varies. It depends on the individual. We don't know. Your conversion rate, Teresa, will be different from mine, will be different from Carl's, will be different from everybody's, right? So, and I don't know if you're a 3%er or you're a 30%er.
Well,
So the conversion is completely unpredictable, right? And so I would never ask someone to take beta carotene. Plus, if you have a history of smoking, then taking beta carotene has been associated with increasing your risk for lung cancer.
come
Okay.
on.
Yeah. So
Jeez
this is,
Louise.
yeah. So I am very careful with that. So, I like to use the active um, form of the vitamin. So usually I use like for me now for my patients and myself, I use the sort of physician lines. Okay. So we have our own line, and I only did that because, everything sucked on the market. So, but yeah, the vitamin D3, vitamin A, active vitamin A, and it's probably a vitamin that you guys have not heard of, even doctors have not heard of. It's called vitamin K2. Okay, there's K1, we're talking K2. So vitamin K2 is really important. And those three I like to put together. Vitamins, I would say D3A K2. I don't know why I say it
Okay.
in that. All right. D3AK2. So D3 is the form of vitamin D. A is the active form of vitamin A. And then K2 is the other vitamin. The reason I like to give those together to my patients is because they work together. Okay. They work together to, let's say, increase your calcium and more importantly, bring calcium to your bones, to your teeth, and not to other areas where you don't want calcium. Where? Like in your arteries, like in your heart, right? You don't want calcium in those places. So when I give the vitamin D, I don't just give vitamin D. I often give it I always actually give it with A and K2 together, right? And most people do need vitamin D. I just never have found someone who's not taking vitamin D who's getting enough vitamin
Well, especially up here in the north,
Yep.
right? I mean,
Yeah.
probably anywhere south of the north of the equator,
Yep.
you got to be
And
like pretty much
right.
living on it, right?
And then the diabetics, people with diabetes, I always make sure that their B vitamins are topped up, B1, but the B complex too, because they need that to help with them some of their metabolic pathways, right?
Mm.
So I think all of that is very dependent on the individual, but I definitely will always kind of recommend the D3AK2, and also we use a very high potency fish oil because that has strong anti-inflammatory effects, and it's also good for your brain. So those are the ones that I really kind of, for me, those are the main basics. Yeah.
So are those the things that, like I have to go and ask my doctor, or is this things that I can buy off the shelf, or is it like I have to go to a specialty doctor? Like how do I get this combination as well as the fish oil?
Well, okay, you're in luck because our store is coming up online so people can order that. So as soon as we
Oh,
get that
nice.
up, yeah, people can order that. But I specifically, so before I just would send people to go and buy it from the store. But when I
Right.
realized that the formulation and also the quality control is not good at all. So
Mm,
an example is the fish oil. So a lot of times the vitamin D, all the vitamins I just told you about, D3, A, and K2, they're all fat soluble. Let's just keep in with those vitamins. They're fat soluble, and oftentimes you'll see them sold in a capsule that has safflower oil or soybean oil and things like that. Now, those are inflammatory oils.
mm,
And a lot of times they're sitting in the shelf for a long time. It can go rancid. And that
mm.
is very, very bad. Okay.
Okay.
So you've just kind of negated the good effects, right? Because it's
Right,
contained in those.
right,
So even that, so we actually did, my staff and I, we went to the store and we looked at all the formulations, and they were all indeed in these different oils that, and we couldn't buy at the time. Anna, who's our head coach, she was pregnant at the time, and she was really like, it was very important to her to get the right vitamins and make sure that
right, right.
they were right potency. So it was like she kept saying, Dr. Loh, look at these oils. And then she was the one who pushed us to like really go and get a high potency and very good quality line. And if it hadn't been for her, I was like, but she's like, look at this stuff. And she made me look, and I was like, oh,
Wow,
not
look
good.
at
Yeah.
that. All right, Dr. Lowe, we could talk forever and a
I
day,
know. I know.
but not but and one of the cool things is that when we were offline, we were toying with the idea of having you come back perhaps once a month, depending on your schedule. We would love that because I didn't even get through my list of things that I wanted to ask you about.
That is funny.
So there's so much to talk about, and there's just
Oh,
so much to learn
and
about our bodies.
it'll give me a chance to dress up the next time.
Okay.
I
All
gotta
right.
level up. I'm like, oh man, look,
Gotta
you
level
gotta
up.
level up,
Listen.
right? Yeah, that's
It's
number
oh,
two.
no problem, no
But
problem at
there's
all.
one more, right? Because you and I go live. Remember in April?
Listen, we got things to talk about. So we mentioned this last week. We're gonna mention it again. It will be on my website. It'll probably be
Yeah.
on yours as well, and we'll put it out to the world. But intentionally, Dr. Lowe and I, we're going to get together and invite you guys, anyone who's listening and friends. We are 3 months into the year. I believe this is
Yep.
Happy Women's Month.
Yes.
And so we celebrate women, and we celebrate just our amazing selves. Not that men can't come, but I'm just saying. But intentionally you is just really thinking about, and a lot of times we think about at the beginning of the year, okay, this is what I'm going to do. This is what I'm going to do. And then we're like, life and, family and everything gets in the way. But we really want to start really thinking about ourselves, thinking about our health, thinking about our mindset, thinking about what are we going to do for the rest of the years for ourselves? How are we going to show up for ourselves? And so we have an event on Sunday, April 7th. It is going to be, there'll be more information coming along, but clear your schedules for the afternoon, early afternoon, about 1 to 3-ish, 1 to 3:30-ish. It's going to be phenomenal, but it's really time to take a look at us as women to really be better, to be our best. How about that?
That's right.
Mind, body, and spirit.
I think intentionally is the word that you and I both love, right? Because, when you get caught up in life, we just kind of drift to whatever needs to be done, whatever needs to be addressed. And then you get to a certain point, you realize, oh, I haven't done all these things that I wanted to for myself, right?
Right.
And so now setting a direction, right, and having some community around that, and having some accountability around that, I think can be really helpful.
It's going to be phenomenal. I can't wait. And this right here has made me even more excited about it. So I can't wait. So by the end of this week, by the middle of this week, end of this week, you will start seeing our invitation wherever you're looking. I'll put it that way. But definitely take a look at our websites. Your website, we're going to put that up again. My website is teresaaline.com.
You can go to tulaversity.com. That's coming across. Yeah,
absolutely. So we will have them both up. It's going to be phenomenal. There'll be a write-up a little bit more descriptive about it, but really it is for all of us to be intentional about everything, about how we think, about what we put in our bodies, about how we treat our bodies. That one vehicle that we have, right? We want to keep it going in all the ways that it should be going. So I'm excited. I can't wait for it. It's going to be great, and there'll be more chances to be able to connect with Dr. Vyvyane Loh, extraordinaire, phenomenal. Amazing.
I think we might have a little dance party in there on April 7th too, right?
No, we got to move. We're talking about moving, right?
Yeah.
We got to move. We're going to do something.
Yep.
Maybe that amazing, fine, ridiculously handsome guy named Carl.
I think you have I think you have some influence, Teresa.
I'm going to try.
Okay.
I'm going to try. Vyvyane, it has been awesome. Thank you so much for hopping on, and I look forward to our just being intentional about getting together.
All right.
All right, everyone, have an amazing night. Thank you for joining Conversations with Teresa. We'll be back again next Monday, but until then, absolutely go on to the website, check out Intentionally You. Check out Vyvyane. It's going to be fantastic. Have a great night, everybody.
Bye.
Bye-bye.